Good evening, respected faculty. I am Dishwinto from Bachelor's of Physiotherapy. Would like to present on the topic classification of fractures on basis of injury. Fractures are breaks or cracks in bones that occur when the bone is subjected to more force than it can withstand. They can vary in severity from small hairline fractures to complete breaks where the bone is separated into two or more pieces. Fractures can be caused by trauma such as fall or a blow to the body or by conditions that weaken the bone such as osteoporosis. Fractures are classified based on various factors including the cause of injury, the location of the fracture, the severity of the break, and the pattern of the fracture line. So I'll be focusing on classifications of fracture on basis of injury. So number one, traumatic fractures. These fractures result from a sudden injury or trauma to the bone. They can occur due to fall, sports injuries, car accidents, or other type of blunt force trauma. Number two, stress fractures. Unlike traumatic fractures, stress fractures occur due to repetitive stress on the bone over time rather than a single traumatic event. They are common in athletes and individuals who engage in repetitive activities that put strain on the bone, such as running or jumping. Number three, pathological fractures. These fractures occur in bone that are weakened by any underlying disease or infection or any condition such as osteoporosis, bone cancer, infections, and the bone may fracture with minimal force or even spontaneously due to its weakened state. 4. Compression fractures. These fractures occur when the bone is crushed or compressed, often seen in the spine due to conditions like osteoporosis or trauma such as fall from a height. Number 5. Avulsion fractures. Avulsion fractures happen when a fragment of bone is pulled away from the main bone by the action of a tendon or ligament. This usually occurs at the site of strong muscle attachment. Avulsion fracture is shown in the image below. And number 6, compound fractures. It is a very big fracture where it is an open fracture with comminuted fractures and the bones are broken into pieces and it goes through the skin leading to an open wound, and this type of fracture is very tough to treat and it can cause risk of infection due to exposure of the bone to the external environment. Number 7, simple fractures, also known as closed fractures, as it doesn't penetrate through the skins or other soft tissues, and these occur when the bone breaks but does not pierce through the skin. Thus, there is no external wounds and they are like hairline fractures, and it would be easier to treat. So in conclusion, understanding the classification of fractures help healthcare professionals determine the appropriate treatment plan and predict the expected outcome for the patient. So this is the end of my presentation. Thank you very much.